Hi, my name is Kara Blando, and for my pediatric assessment, we're going to be doing it on Winnie here. So to begin, I'm just going to not introduce myself. Hi, I'm Kara, I'm the nurse practitioner. I'm going to wash my hands and put on some gloves. Both mom and dad are present. So I'm going to just talk to them and ask them all of my questions. So they're telling me their chief complaint is they just want a physical exam on their newborn baby. They don't have any concerns, no other chief complaint. This is Winnie. He's a 5-day-old Caucasian newborn. He's a newborn, and he was born at 7 pounds 4 ounces via vaginal delivery, no complications. Mom had a natural delivery. She was not taking any medications. She had her prenatal care. He was born at 39 weeks, and when he was born, the APGAR score was 10. There were no breathing difficulties. He didn't have to go to the NICU, no oxygen needs. Very healthy little boy at birth, and mom and baby stayed at the hospital for only 2 days. Mom had no medical history. This is her first pregnancy, first child, and she did not have any hypertension either before, during, or after pregnancy so far. And she doesn't have any medical history on her side or her family side, and neither does dad. He doesn't have any history, and neither does his family. They have not had any recent illnesses, including while the mom was pregnant. There were no fevers or recent illnesses, and everything was okay from there. Mom and dad state that baby is exclusively breastfeeding. He has been eating from 22 to 25 ounces of breast milk a day. He's latching appropriately, no issues there. Mom denies any signs or symptoms of postpartum depression. They feel that they have a lot of support from one another, their families, and their friends and their church community. Living in their 2-story home in their gated community is just mom, dad, and Winnie. And dad is an accountant and mom is a nurse. They, during pregnancy, mom did not do any drinking, smoking, drugs. They do not have access to firearms in the house, and they do have access to clean running water, electricity, healthy food, and quality health care. So moving on to the review of systems, they deny any recent illnesses or fevers that Winnie has been having, no recent weight changes, no skin pigmentation changes, no coughing, no rashes, bruises, or traumas, no falls, no conjunctivitis, straining ears, no abnormal head shape, no apnea or snoring. They say he's been having 3 to 4 bowel movements, and they have been transitioning, so now they're green. Before it was more meconium, like green, black, tarry. Now it's a little bit less tarry and green. They deny any diarrhea or vomiting. He's been having about 3 to 5 wet diapers a day as well. No hematuria, or no discharge. They also deny any joint swelling, traumas, or falls. So we're going to do some vital signs here. So we're going to unswaddle him gently and make sure he has make sure he does not have a wet diaper. Make sure it is dry for when we weigh him. Very good. He's now 7 pounds 9 ounces. And we're going to check his length here. And he's about 15 inches in length, which is very good. And we can check the head circumference. I'm gonna leave it at the base of the eyebrows here for when I do this, and it's about 35 centimeters, which is very good. We are going to do the respirations, heart rate, and temperature later, because we want to do the least distressing to most distressing for the exam, pediatric exam. So we'll leave that a bit later. So now we're going to go into the general observation. So he is awake, he is calm, consolable, he's looking around, very cute little guy. No difficulty breathing, no cyanosis, jaundice, or erythema. And now we're going to go to the head. So looking at his head here, going to lift him up and just feel all around, feel the suture linings. We have the anterior fontanelle, and that would close about 8 to 9 months to 18 months up to 2 years. And then the posterior fontanelle would close around 2 months. He does not appear hydrated because the anterior fontanelle is flat, it's not swollen or anything. Even distribution of hair. His head is evenly and appropriately shaped. I'm going to put him down, look at his ears here. So both ears are placed appropriately, the helixes are present, no skin tags. You wouldn't see the tympanic membrane until about 5 to 6 months, but we can just look a little bit to the otoscope, just make sure there's no blockages or drainage or anything. And I don't see anything on either side, very good. So we can go on to the eyes here. So conjunctiva are pink and moist. No conjunctivitis, no drainage. Sclera is white, they're not jaundice. Very good. We can check the red light reflex. I'm going to cup his eyes because this exam room is a little bit bright. And then, here we go. I'm going to check. Oops. There we go. Red light is present in both eyes. Pupils are equal round reactive to light. His eyebrows are appropriately placed, evenly shaped. Now we can go on to the nose. Make sure he's a cute little button nose placed appropriately midline to his face. Make sure the nares are patent and that he can breathe appropriately. So we're just checking, looking. I don't see any blockages or anything. Can check again very quickly with this. Yeah, I don't see anything. So with a gloved finger, I'm going to put my index finger here inside of his mouth. I need the sucking reflex intact. He's already sucking my finger. I feel the hard palate, soft palate, and he's still breathing appropriately, so everything looks good there. I'll look at the oral mucosa, pink and moist. I see his gums here. There are no teeth present. And then he's sticking out his tongue past the lip line, which is great, exactly what we want. I don't see any oral thrush. His lips are pink and moist, so everything looks good there as well. So now after that, we can go to the neck. We see the trachea is midline. There's no webbing and no redundant skin on either side. Very good. So now I'm just going to feel the clavicles. I don't feel any crepitus. It feels smooth. There's no breaks or step-offs, which is very great. And now we can go on to the chest. So it is flat. It's not concave. There's no difficulty breathing observed. Good color. It's no cyanosis or jaundice again. So now I'm going to count his respirations for a full minute starting now. Okay, so his respirations are about 45 a minute, which is good. That's within the normal range. And now what we can do is we can auscultate his breath sounds, make sure everything looks good. So we'll do that. We'll do the anterior lung field, the lateral, to the sides, and then posterior. Very good. Clear passage of airway here. No wheezing, rhonchi, or crackles. Bronchovesicular sounds are heard throughout. And so now what we can do is go on to the cardiac. And so we can just feel those little pulses up here, the brachial pulses, which feel good, +2, strong bilaterally. And then we're going to listen to all 4 landmarks. So we have the aortic, pulmonic, tricuspid, and mitral. And then we'll also go on to the apical, and we'll listen to that for a full minute so that we can get the heart rate. All right, so his heart rate is 132. Oops, I got stuck in my hair. So 132, which is normal. Very good. And I heard normal S1 and S2 sounds, no extra heart sounds, no murmurs or gallops or anything like that. So that is all good there. And now what we can do is go on to the abdomen. So just looking at his skin here, no jaundice, no cyanosis, again, or erythema, rashes, or anything. We're going to look at the umbilical cord. We're going to tell the parents don't bathe him until this falls off. It will fall off on its own, so don't force it off. And he does have a protuberant abdomen, which is normal, the normal finding in newborns. And so before I feel the abdominal area, I'm going to listen to all 4 quadrants, make sure everything looks okay, sounds okay. So bowel sounds are active in all 4 quadrants, and as I'm auscultating throughout all regions, I'm using the bell just because it is smaller. And making sure that it's of course warm before I touch his skin as well. And so now what I'm going to do is gently palpate with one hand on top of the other, make sure there's no masses or organomegaly as I'm moving around, and I don't feel anything. So that's good there. And now what we can do is go onto the groin, so I'm going to take off his diaper. And I don't see any abnormal curvatures of the penis. I see the scrotum. There's no, doesn't appear to be erythematous or swollen. So now I'm just going to feel it. Yep, it's not swollen. And then both testes have distended, which is great. So now I'm going to check the femoral pulses down here as well. Good, +2, strong, equal bilaterally. And then I'm just going to look at the patency of the anus down here. So I'm going to lift up his legs with one hand and then spread apart the gluteal fold with my other hand. Check, good. I'm gonna put his diaper back on. But before I put the diaper back on, I'm gonna get that rectal temperature since we're already here. Okay, and it is 98.5, which is good. So now I'm gonna put the diaper back on. And next I'm going to check for hip dysplasia. So by doing that, so we're gonna do 2 things. We're gonna do Barlow. So we're just going to adduct the hips and with some posterior pressure just go down a little bit. Very good. I don't hear or feel anything. No crepitus, cracks, or pops. And now it's going to do the ortolani, which is flexing the knees at 90 degrees and then moving them out, abducting them. Good. Same thing. No crepitus, pops, or cracks. I don't hear or feel anything. And so now we're going to do the extremities. He has 10 toes down here, 10 fingers, normal length for all of them. No missing or extra digits, and as I'm looking at the palms here, no single transverse crease. So next what we're going to do is the back. So I'm just going to gently turn him over, look at the skin here, normal curvature of the spine, no lesions, rashes, skin pigmentation changes, no sacral dimple, and the gluteal cleft is symmetric. I'm going to gently place him back, and now we're just going to do the neuro exam. So as I already mentioned, he's awake, calm, consolable. Second reflex we already know is intact from earlier, and we can do the palmar grasp reflex, and he's gripping on, which is great. Do the Babinski on the toes, and I'm stroking down here. The toes are fanning out on this side and on this side, which is very good. We can do the rooting reflex. So I'm going to stroke his cheek to the corner of his mouth, and he's turning to suck my finger. And then on this side, he's doing the same thing, which is very good. And now we can do the Moro. So I'm going to pull him towards me and then have his head drop into my other hand. It's going to startle him a little bit, so his upper extremities are going out and extending, which is great. And since we're already up here, we're going to do the stepping reflex. So he's trying to take steps as I'm holding him up, which is very good, and he has appropriate muscle tone. He's not too flaccid, not too stiff. Perfect. So I'm going to swaddle Winnie back here, and I'm going to tell the parents the plan of care. So this is a normal, healthy boy. I'm going to tell them all the positives as I'm going through this exam like I had. No concerns, and if they do have any concerns, I would be more than happy to address them, and they are more than happy to come back, of course. And there's no need to do any additional things aside from the standard of care with appointments, just normal checkups and vaccination appointments. And I can provide more education, and I can provide resources if needed. They did say they feel very supported, but I could provide more lactation resources or support groups, different things like that, or just education resources. And again, mom denies any postpartum depression signs or symptoms at this time. And so next I would educate about vaccines. So they inform me that the baby has already had his hepatitis B vaccine within the first 24 hours after he was born, because he was a full-term, normal, healthy infant. And so his next dose could be due in 1 month, or at 1 month of age. But since we have some other vaccines scheduled for 2 months, it might be easier just based on the parent's preference if they would want to just get them all done around the same time or spread them out. I'll leave that decision to them. But at the 2-month mark, we can do the rotavirus, we can do the pneumococcal, the polio, the Haemophilus influenza type B, and the DTaP, which is the diphtheria, the tetanus, and pertussis. And yeah, so again, I would just continue to reinforce education and answer any questions or address any concerns the parents may have, and thank them for their time and allowing me to assess their newborn. Thank you.